addition to obviously the standard brushing, flossing, going to the dentist twice a year, are there any advancements at home oral care that you find to be more effective in terms of keeping your mouth in the best condition?
I've really shied away from things like mouthwash, especially alcohol-based mouthwash, because I don't want it to decrease my saliva production. Preventing root canals is easier than we think, and it's simpler than we think. So bleeding gums is an important sign that I think sometimes triggers people to not want to brush and floss anymore, but it's actually the opposite. When you see bleeding gums, it means you're not brushing and flossing enough typically. And so that's a great sign that is just telling you, hey, there's some inflammation in your mouth that could be then leading to inflammation in your body. And so really taking care of it at the gateway is important. Another sign and symptom that I see often overlooked is like maybe some cold sensitivity or heat sensitivity in your mouth, or even biting sensitivity. Sometimes a tooth nerve can die spontaneously, or there's a reason, but you may not have any pain associated with it. And that you may have like an intermittent pain, or maybe like a little swelling that comes up or goes away. Or maybe you feel like, oh, I got food stuck here. Let me see if I can floss it out. That kind of sensation. And then it goes away for a period of time, and then it comes back. And then all of a sudden you realize you have this really big infection. So I will say that our bodies are constantly giving us signs and symptoms, especially in the mouth, that are saying, hey, knock, knock. There's a little problem here, like catch me while I'm small. Don't ignore me. But unfortunately, some of oral pain is very intermittent and may not be a constant signal that there's a problem. And so I think really being in tune with what our mouths are telling us is a very important piece of staying healthy.
Yeah, no, I couldn't agree more. I think it's so important to shine light on the importance of oral health, the oral microbiome. And I'm so thrilled to have you with us today to share your wisdom with our listeners. I think the mouth is really the entryway into our body, and we usually don't associate that with our overall well-being. But I think that there's so many signs that our body gives us. We just usually have to actually listen to them and pay attention. Can you tell us maybe some signs that you have seen in terms of dental health issues that people may overlook that they should actually pay attention to?
I think one thing that I see quite often is like having a little like bump on the gum, and then that bump might drain. That is a sign that even though it drained, you still have an issue. And so don't brush that under the rug. It's an important signal that you need to go get something, visualize, maybe some imaging and a deeper look. That's a big one. And again, I think the bleeding gum thing is something that people can brush off, or just any puffiness in the gum. Biting sensitivity is a big sign. In my world, as a root canal specialist, I always tell people, if you have a root canal problem, usually the signs are you have some sensitivity to hot, cold, and biting. So if it's any one of those things, it's typically a root canal issue. And sometimes you can reverse it. Sometimes you can prevent a root canal from happening if you actually listen to those signs and symptoms. So that's probably the biggest reason why I think it's important to pay attention to these signals.
Hey, we're taking a quick pause to talk about something crucial: your sleep. Did you know that you spend 1/3 of your life in bed? That's a lot of time, so it makes sense that the quality of your mattress can dramatically enhance the quality of your rest. That's why I want to introduce you to my personal favorite avocado mattress. It's your first step towards sleeping like a baby every night. Why avocado? Well, here's 3 reasons this mattress is more than just a bed. It's a transformation of your bedroom into a sanctuary of sleep. Number 1, it's natural and non-toxic. If your bed came in a box and was not organic, this is for you. Avocado mattresses are made from organic materials like natural latex, wool, and certified organic cotton. This means no off-gassing of harmful chemicals, so you breathe clean air all night long. Number 2, it's unmatched for comfort and support. With its advanced ergonomic design, an avocado mattress provides the perfect balance of comfort and support. It contours to your body, relieves pressure points, and helps align your spine. Say goodbye to tossing and turning and wake up feeling refreshed and pain-free. Number 3, an organic mattress can dramatically improve your health by reducing exposure to toxins and allergens while supporting your body's natural sleep. So, if sleep has been an issue, right now is a perfect time to transform your bedroom into a sanctuary where every night is a rejuvenation session. Visit Avocado Mattress. There's a link in the show notes to see why switching your mattress could be the best decision you make for your sleep and your health. Don't wait to make sleep a priority. Your body and mind will thank you. I think when people hear the word root canal, they probably tend to freak out in the chair. I guess, can you
Yeah.
tell us a little bit, what are some common misconceptions about oral health that you frequently encounter in your practice, especially when it comes to root canals? Like, are there so many layers that happen before the need of a root canal that maybe are often overlooked? Like, is there a way for someone to sort of maybe prevent a root canal from happening
Sure.
beforehand?
I mean, I think preventing root canals is easier than we think, and it's simpler than we think. And I know some people may feel like it's cliche to say, oh, brushing and flossing and going to the dentist twice a year, but in reality, that's how we find things when they're tiny, and they can be maybe fixed with a simple filling as opposed to letting it go and becoming a bigger problem, which becomes more expensive. And then, of course, having to sit for the root canal, which doesn't have to be dreadful, I promise. But I mean, everyone says there's nothing worse than getting a root canal. I can think of several worse things, but um, especially nowadays with all the modern advancements and how we do it. But again, like so much of what I do can be prevented. I feel like my practice shouldn't be as busy as it is. And I think if we focus on getting to the dentist and not letting it be, just making sure it's a priority, right? And I think some people are like, oh, I don't have dental insurance, so I can't go to the dentist. I think that's a big issue because you can still go to the dentist. And it's actually probably more economical to go to the dentist when you don't have a problem than spending all this money on dental insurance and then not having anything to do. Does that make sense? Like,
Yeah.
it shouldn't be the ticket to go to the dentist. You should go whether or not you are covered or not covered by insurance, because that's how you keep things super affordable when it comes to your oral health.
Yeah, I think it just comes down to actually typical human hygiene, and that not to just let your mouth go by the wayside. And I like that what
Yeah.
you said is, make sure you're doing, especially I'm a parent, like you have your kids, you make sure they're going twice a year. I know for myself, the way that I make those things happen is every time I'm leaving one of those appointments, I just book the next one. It's in your calendar.
Right.
And then so many months in advance, you just schedule around it so you know that you got to go. You have to make that happen, because I always believe in
Right.
getting out ahead of something and being able to, you know, make sure you don't have any issues before they build up and become a big issue. And then, of course, if you happen to end up with a big issue and you need a root canal, then that's obviously what was meant to be. But sometimes maybe you
Right.
can prolong the frequency or the timely manner of it. Why is there there's so much stuff people probably say on social media around root canals. There's a lot of emotions around that. Can you tell us about, how you in your practice have become a root canal expert and sort of how you do things maybe differently than other places?
Yeah. So I am a dentist, but more specifically, I'm an endodontist. So I am a root canal specialist, aka tooth healer. And we're a very specific type of dentist. And I think number one, people are not aware that this specialty exists. So for the past 16 years, I've been doing 8 to 10 root canals a day, 5 days a week. So that's a lot of just doing one thing, right? And there's so much in each specialty of dentistry that I think even for myself, like as an endodontist, I don't know all the tricks that a periodontist does. I don't know all the tricks that an oral surgeon does, or a pediatric dentist, or an orthodontist. And we're all within dentistry. And so I think that's important to note that, there may be some dentists who are out there kind of talking about things, but I don't think they know exactly what we do as endodontists. And I will say in the last 6 years, so much has changed in our field and how we do root canals. The technology that's available to us nowadays is so different. Number one, it makes the whole procedure faster, more efficient, better outcomes, more comfortable. I do things in less visits now. My patients have less post-op pain. But more importantly, these outcomes are so much better than they used to be. And I can even compare my own treatments from back in the day, 16 years ago when I was practicing, to now, because I follow up my patients and I actually see what's happening. And now I've had to even redo some of my own cases from the past with my new resources, with my new technology. And now we're seeing the healing that we want. So there's so much bad fake news, I guess you can say, about root canals online. But I feel like people don't really understand what advances have been made so recently. And even dentists out there that have no idea how we're doing root canals differently.
And
And
so
I think
why
that's
do
really
you think
important.
that there's been a push against root canals? There's been definitely a whole movement there, sort of an
Yeah.
anti-root canal movement. So for someone who's listening, how can we maybe
Hmm.
open their eyes to sort of seek out, many different
So
options for them?
there is a difference between a bad root canal and a good root canal. And there's a lot of bad root canals out there. So I understand where this notion came from, because 50% of what I do in my practice is actually redoing root canals that weren't done with the proper standards.
Yeah.
And it's not that the dentist who did it was trying to do a bad job. They were doing the best that they could. The problem is really the education. When I was in dental school, I only had to do 4 root canals to graduate. That requirement has actually decreased over time. And so people are graduating with only doing 2 root canals, and then they're able to do it. If somebody just delivered 2 babies in med school, would you allow them to deliver your baby? Probably not. But I don't think people really understand the education that we're given. And we're actually taught that you can do this when you leave. In fact, doing root canals and getting people out of pain is probably one of the number one things we do as dentists. Our patients seek us out when they have a toothache
Yeah.
most of the time, or a tooth problem. And so a lot of times that's the treatment plan. And we think we're equipped, but we're not. Even as I graduated and then I did my residency, I thought I was I thought I had it down going into my residency. And then even through my residency, I thought I had mastered it. It wasn't even until maybe 3 years into practice that I really feel like, okay, now I really understand this. So as a patient, you should know that you have choices. You have a choice to have your root canal done by a general dentist. And there are some general dentists who can do a really good job. Or you can go see an endodontist who this is all that they're doing. And if you want to make that choice, yes, it might be a more expensive choice, but I don't think by much. That may be getting a treatment done, and that's the only treatment you need on that tooth. Whereas some people are getting a treatment done, and then in a few months, they still have the same problem. And then we have to go back in and fix it. And so you can see how this negative kind of experience kind of lingers with this one procedure, because people say, well, I had a root canal, it didn't work. It's toxic. I have this, infection still in my bone. But the problem is really the education that dentists are getting. It's just not enough. And we need to do better. And that's kind of why I'm on this mission to help I help dentists get better at doing root canals, but also create that awareness for patients so that they know what questions to ask when they go to the dentist, so that they know what they're
100%.
getting.
Yeah, most people, I think, in myself, like I wouldn't know to ask for an endodontist if I needed a root canal, but now I
Yeah.
do, thanks to you.
Yeah.
Yeah, with the rise of stress in, today's day, have you seen an increase in root canals over the years in your practice, or has there been a decrease? Like how is, I know America as a whole, our health has been in a constant state of decline. Are you seeing that in tandem in combination with root
Yes.
canals?
And and much of the reason is that stress is one of the reasons why people will clench and grind their teeth, and then there's more force placed on the teeth, and that induces cracks, and then that crack becomes an entry point for bacteria to get in to the tooth and then create an infection. And so we are seeing an increase in cracked teeth. And again, and not that it's really neglect, but we are seeing that people are too afraid, or maybe they don't have the finances to go to the dentist. And so things will accumulate. And so they'll have things like deep decay, which they kind of let go too long. And then again, they need treatment rather quickly. We, as endodontists, I feel like we're an emergency room for teeth,
Yeah.
because most of the time people are coming in
It's like critical,
urgently, and
mission critical.
right, they need care like today.
Yeah.
And so I have seen an increase in that, but I've also seen an increase in cracked teeth due to stress.
Yeah, yeah. I always say we need to parent ourselves like you would parent your own
Me
child,
too.
whether you have children or not. And so, in addition to obviously the standard brushing, flossing, going to the dentist twice a year, are there any at-home tools or technologies, any advancements at-home oral care that you find to be more effective in terms of keeping your mouth in the best condition?
I love all those little tactics. I will say I'm going to add some tongue scraping to the
Yes.
mix. I think I like to keep things that are like really easy to do, economical. I travel with my tongue scraper all the time. I think it's just a critical part of my oral hygiene regimen. I've really shied away from things like mouthwash, especially alcohol-based mouthwash, because I don't want it to decrease my saliva production. I think really understanding the value of our saliva is important. Our saliva is a buffer, and it keeps the pH in our mouth very neutral so that we don't shift into an acidic environment and then have decay start to become rampant. So anything that I can do to really maintain my saliva production is critical, like staying hydrated. And I also like to make sure that I chew a lot. I know all of our foods, they're getting softer. And so I want to make sure that I'm utilizing my oral musculature. I think that's helpful for your airway and everything. But, and also to also keep that saliva production. I think mouth taping at night is really important too. Again, so that you don't dry out your mouth and you get more restorative sleep for sure. And another thing that I like to do is really minimize like snacking, because every time you have something that's sweet or anything that's of a carbohydrate, that is what's going to decrease your pH in your mouth. And so just like you want to inhibit like too many glucose spikes during your day, you also want to inhibit the pH from dropping. So it kind of goes hand in hand. I think it's interesting to see that correlation, is that if we keep like our dessert at the end of a meal, it's healthier for you, and don't have it like in between your meals, you're going to see that you're going to drop the pH in your mouth less frequently. And so there's less opportunity to have that decay opportunity. So
I think
those are
those are
probably,
two amazing, great points. I
yeah,
also love tongue scraping, and I do it. My kids do it. Can
good.
you maybe explain why tongue scraping is important? Because some people may not know about it. Sometimes my husband just thinks it's me being weird, but it's an ancient practice that's been around for a
Yeah.
very long time.
I think it's very similar to why brushing and flossing is very important. So bacteria like to congregate, and they like to create these colonies and biofilms. And so anytime we can physically disrupt those, whether it's brushing, flossing, or tongue scraping, I think it's beneficial because it prevents your oral microbiome from going into a state of dysbiosis. And so brushing is important. You don't even need toothpaste. It's really the act of brushing and breaking up the colonies that's important.
Yeah.
Same thing with flossing. Flossing is going in that contact point where nothing else can go, and getting like where the teeth touch. You know how like when you floss, you feel that click?
Yeah.
That click is a place that nothing can clean it. No water pick, no toothbrush, but the click is where the floss can go. And again, you're disrupting those colonies. And so the same thing for the tongue scraping, just making sure that things aren't accumulating and biofilms aren't happening.
Yeah, and I think thinking about your oral pH is something that I actually never gave so much thought to until I started really diving into research. I know about our body pH. Disease does not grow in an alkaline environment, but the starting point can be the mouth, that your mouth can be more acidic. And it's funny because my kids, when they were little, they were actually told to use mouthwash. And I wonder, I mean, I know you don't probably focus on kids, but if there was a study to show that kids are rising in cavities, and it's not just because gummy vitamins, that it could be due to the mouthwash altering the oral pH in their bodies at a young age.
Yeah, I just like to use regular water because again, it's the action of the rinsing as opposed to the actual medicament. So actually I start my day by rinsing my mouth out with water first and using water as the mouthwash.
Yeah, I love that. That's kind of like what I do at home
Mhm.
too. I guess for anyone that is looking for, if they are in a problem, they do need a root canal, is it the type of certification that they should ask their dentist is if they have an endodontist within the office or to be referred out to an endodontist?
Yeah, typically endodontists will be in their own practice. However, there are some practices that do have an endodontist in-house. I think it's important that you know what questions to ask. I think when I do a root canal, there's a few things that I need at my disposal in order to feel like I'm really giving the quality to my patient. Number one, I want to use 3D technology. So a cone beam scan is really important for me. And that allows me to see what the anatomy in the tooth looks like before I even get inside the tooth. Because root canals only work when you find every canal and get to the end of every canal. And those canals can be teeny tiny.
Mm,
And the next thing you want your endodontist to be using is a microscope, not the funny little goggles that a dentist wears. Those are called loupes. You actually want to be using a microscope. So my microscope actually comes off of my wall. It's like this big. It's a huge thing that I do like my whole procedure through, kind of like what a neurosurgeon would use on your brain.
okay.
Uh, and then the next thing I use is a gentle wave, which is a new technology that actually uses sound waves to take the disinfection solution and pump it through the tooth and get into those hard to reach places and actually penetrate the dentine tubules, which is what everyone has said in the past that we can't do. And now we can do that. And so if you are one of those people who really doesn't want to lose their tooth and you've been prescribed like either a root canal or an extraction, because once your tooth gets infected, you need one or the other. And you're weary about somebody saying, oh, you got to just take out that tooth. Like, listen to your gut and find an endodontist who has this trifecta of technology. Because what we're seeing, and I actually can share with you some pictures if that's beneficial, of how root canals not only save your teeth, but they're actually regenerative. Like if you have an area where you've got like a dark shadow on your x-ray, you've been told that, and you have a black spot on your x-ray, that's an area where you've lost bone because you've had an infection sitting there for a while. Well, when you do a root canal and you follow the cardinal rules of doing it the right way, you not only save your tooth, but you actually can regrow your bone back. So
Wow.
root canals are actually very regenerative. I've actually regrown sinus membranes after doing a root canal. I've seen so much inflammation like totally recede, like really recede. I have a beautiful case if you want to see it, but I understand. I don't know if your audience is just audio only, but
No, they're visual too. I mean, you could show us some
they
pictures.
okay, let me show you an example. Let's see. I'm going to share my screen.
I think it's always helpful to see something. And I love that you're giving us some key information and questions to come in. I always say I want to empower people to take charge of their health. So I think now, after listening to this interview, they can advocate for their own health and make sure when they're calling for an endodontist what different tools to ask for. Because unless someone explains it to you, unless you maybe have a
Right.
friend or a family friend, like nobody really knows this information.
Right. All right. Do you see my
I
screen?
see it. Tooth story. Here we
Okay.
come.
Okay. So I love to talk on tooth stories because I think it makes sense. So here is a patient of mine who they had a root canal before, and you can see this white filling here
Yeah.
that's inside the tooth. That is the sign that a root canal has been done. Now, I don't think this is a really pretty root canal. I think it can be improved. Well, I ended up taking a 3D scan, that cone beam scan, and this is the tooth. Again, you see the 1, 2, 3 canals that have that white filling in it.
Yep.
But look at this guy. This canal in the tooth was never filled. So if this root canal was done 10 years ago, this bacteria that's in here is actually 10 years old. And you can see the impact if you look, so you can clearly see that canal. So the two cardinal rules of root canal therapy were not followed here. And so they did not find all the canals. They did not get to the end of every canal. Okay.
Right.
Those two rules have to be followed. And so this right here is the sinus, and this is a break in the sinus floor. And this is the mucosa of the sinus fully inflamed. You can actually see the inflammation.
Wow.
And here's another view. Okay, this is, again, just taking the same 3D cone beam scan and turning it around. And you can see how the floor of the sinus has been eaten away. So this is all bone loss. And all of this is happening because of this tooth infection. So this patient actually not only had tooth symptoms, but they also felt like they needed sinus surgery.
Ooh.
Okay. Yeah. And so I redid the root canal. Okay. You can see it looks a little bit different than the one before. It has like a fourth leg here. And you see we went a little bit longer in the root as well. And then we followed up the patient. So 1 year later, they came back and look, this was before. And you see that broken border of the sinus. And this is 1 year later. You have to give root canals time to heal. So if you give it 1 month, 2 months, it's not enough time.
Yeah.
It takes a good year to see that regeneration. And you can see the floor of the sinus has fully regenerated. And all of that mucus right here has retracted. It's receded. So there's no more inflammation in that sinus membrane. So that's a perfect example of how we can regenerate your own tissues just from doing the root canal with the right method. So you can see here, that's that second canal in that root that was treated.
Are there connections to if you're having sinus problems that maybe your root canal, is there a connection there between
sometimes you think it's a sinus infection, but it's actually a tooth infection giving you the same signs.
Wow.
So sometimes you have to see the dentist and not the ENT.
Right.
So you can see here, this canal wasn't treated, but then we treated it.
Yeah.
So it's not that root canals don't work. It's that bad root canals don't work.
Yes. We're going to flip the script today after today's interview. Thank you so much for all of your amazing wisdom. I always love to close out my interviews by asking our guests, what is one drop of wellness wisdom you'd like to leave with our listeners today?
I just want to say, don't hate your dentist. We're on your team. We're on your team. We actually want to save you time. We want to save you money, and we want to save your teeth. Let us be a part of your whole health team, because I think that's really important.
Thank you. Thank you so much for being with us at the Well Drop. We will share in our show notes. If you have any questions, you can definitely reach out directly to Dr. Chopra. And thank you so much. I'm going to actually circle back to like the very beginning. I just want to catch those that we missed. 1 second. Thank you for being with us at the Well Drop, Dr. Chopra. I think it would be best to start by having you explain why oral health is such a crucial component of our overall wellness, because I think most people don't think about your mouth and equating that to your well-being.
Yeah, our oral health is so important. If you think about your mouth as the gateway to your body, and really think about what value your mouth brings. I mean, it brings us nutrition, it brings us hydration, it brings us confidence, it brings us airway. Actually, the more we chew, develops our airway. So our mouth brings us breath too. So there's so much value in this little box here. And I think it's time to shine a light on it.
Yes, and we will definitely be doing that today. Can you tell us maybe what are some early warning signs that our mouth can give us that we should maybe pay a little bit more attention to and realize that, oh, our body might be inflamed and we sort of need to, take it to the next level?
Our bodies are so smart, and they really give us the signals that we shouldn't ignore. And I think one of the biggest ones that I see a lot is just bleeding gums. Bleeding gums is a sign of inflammation. This is gingivitis. And this is something that I feel like some people are like, well, I didn't want to brush brush too hard or floss too hard because my gums were bleeding. And when you see your gums bleeding, that's a sign that you're not brushing and flossing enough, and you actually have to brush and floss a little bit more. And then once that inflammation goes away because it's free of plaque, you'll see that that bleeding stops. So that's one of the biggest ones. And then also as an endodontist, I feel that the 3 signs that come to my patients when they have a root canal problem is that they can have sensitivity to hot, cold, or biting. Those are probably the 3 signs that signal to somebody that you need to end up in my chair.
Yes, I think most people don't want to end up in the chair, so they really ignore, and then all of a sudden they end up in your chair, but out of an emergency rather than coming, and maybe you would have a job to do, but maybe not as big of a job to do. Like, do root canals, when you have an infection, do they spread amongst teeth, or does it usually stay
They don't.
localized?
Again, our bodies are smart. We were made in a very unique way, and we have things that protect infections from spreading from one tooth to the next. We have what we call the periodontal ligament that actually attaches your tooth into the bone, and that ligament prevents infection from going from one tooth to the next. So you can get a cavity from one tooth to the next. That can definitely jump ship because a lot of times where teeth are touching each other, you'll see like a kissing cousin like cavities, but it doesn't happen when the tooth has gotten infected. It doesn't travel through the bone that way.
Got it. Okay, well, that's good to know.